Imagine a young woman named Sarah, crippled by debilitating migraines. She's tried every medication, every therapy, but nothing works. Her doctor offers her a new pill. He claims it has shown great promise. Sarah is skeptical but desperate. She agrees to try it. To her surprise, the pill works. Her migraines become less frequent. There's just one problem. The pill is a placebo. It contains no active ingredients. How could something with no medicinal value be so effective? The use of placebos in medicine is not new. For centuries, healers have recognized the power of belief in the healing process. Long before the advent of modern medicine, rituals, symbols, and ceremonies played a crucial role in treating the sick. Ancient Egyptian priests used amulets and incantations to ward off disease. Shamans in indigenous cultures performed elaborate healing rituals, invoking the power of spirits and nature. These practices, while lacking a scientific basis, often provided relief to the afflicted. The power of belief, it seemed, could manifest in physical changes. These ancient practices, though seemingly primitive, foreshadowed our modern understanding of the placebo effect. They recognized that the act of treatment, the ritual, the belief in a cure, could have a tangible impact on health. Modern science, with its emphasis on empirical evidence and biological mechanisms, initially struggled to explain the placebo effect. How could a sugar pill alleviate pain or reduce symptoms? Recent advances in neuroscience, however, have begun to shed light on this enigmatic phenomenon. Studies using brain imaging techniques like fMRI have shown that placebos can trigger measurable changes in the brain. When a person believes they are receiving a beneficial treatment, even if it's a placebo, their brain responds as if it were real. This suggests that the placebo effect is not merely all in the mind, but rather a complex neurobiological process. Researchers have identified specific neurotransmitters, such as dopamine and endorphins, that are involved in the placebo response. These chemicals play a crucial role in our experience of pleasure, reward, and pain relief. By understanding the neural pathways involved, scientists hope to harness the power of the placebo effect for therapeutic benefit. One of the key neurotransmitters implicated in the placebo effect is dopamine, often referred to as the feel-good chemical. Studies have shown that the expectation of receiving a reward, such as pain relief from a medication, can trigger the release of dopamine in the brain. This dopamine release, even if prompted by a placebo, can lead to real physiological effects. For example, in studies of Parkinson's disease, a neurodegenerative disorder characterized by tremors and movement difficulties, placebos have been shown to improve motor function. This improvement is thought to be linked to increased dopamine activity in areas of the brain involved in movement control. The placebo effect is not limited to dopamine, however. Other neurotransmitters, such as endorphins, the body's natural painkillers, also play a role. When a person believes they are receiving pain relief, their brain may release endorphins, leading to a reduction in pain perception, even in the absence of active medication. Section 5: Placebos in action, from pain relief to Parkinson's. The placebo effect has been observed in a wide range of conditions, from pain and depression to irritable bowel syndrome and Parkinson's disease. In clinical trials, placebos have been shown to alleviate symptoms, improve quality of life, and even alter physiological markers. In one study, patients with irritable bowel syndrome who received a placebo pill presented as a powerful new drug experienced significant improvement in their symptoms compared to those who received no treatment. The act of taking a pill, coupled with the belief that it was an effective medication, seemed to influence their physiological response. Similarly, studies on depression have shown that placebo pills, when administered with empathy and positive suggestion, can lead to improvements in mood and reductions in depressive symptoms. This highlights the importance of the patient-physician relationship and the power of therapeutic communication in shaping treatment outcomes. Section 6: The power of ritual. Why the act of taking a pill matters. Why is the act of taking a pill, even a placebo, so powerful? Researchers believe that rituals like taking medication play a crucial role in shaping our expectations and beliefs about treatment. The act of swallowing a pill is not a neutral event. It carries with it a weight of expectation, a belief that something is being done to address the ailment. This ritualistic act can trigger a cascade of physiological and psychological responses that contribute to the placebo effect. Furthermore, the environment in which a placebo is administered can influence its effectiveness. A placebo given in a clinical setting by a healthcare professional wearing a white coat is likely to elicit a stronger response than one given in a less formal setting. The cues and symbols associated with healthcare can shape our expectations and beliefs about treatment, influencing our physiological response. Section 7. The unpredictable nature of hope, variability in placebo response. The placebo effect is well documented but not a magic bullet. Its effects are variable and unpredictable. Factors like personality, experiences, and illness nature influence the response. Some are more suggestible, experiencing stronger placebo effects. Positive healthcare experiences can enhance placebo responses. Placebos work better for subjective conditions like pain and mood disorders. Section 8. The unexplored territories of the mind. The placebo effect, despite decades of research, remains a scientific enigma. It challenges our understanding of the mind-body connection and raises profound questions about the nature of healing. How can our beliefs, our expectations, our thoughts influence our physical well-being? As we delve deeper into the mechanisms of the placebo effect, we are uncovering the untapped potential of the human mind. The act of believing in a treatment, even if it's a sham, can trigger a cascade of physiological changes that promote healing. The placebo effect is a testament to the power of hope, the importance of the patient-physician relationship, and the complex interplay between the mind and body. As we continue to unravel its mysteries, we may unlock new and innovative approaches to healthcare, harnessing the power of belief to promote healing and well-being.